Hello, my name is Connie. I'm a CVT here at DoveLewis, and I'm going to talk to you today about esophagostomy tubes, commonly called E-tubes. I'm going to explain what they are, why we place them, how to use them, how to care for them, and just generally what to expect when taking a pet home when they have had a E-tube placed. So to start, this is an E-tube before it's been placed. The sort of self-explanatory, it's an esophagostomy tube, meaning that it has been placed into the esophagus. It's nice and flexible, and then it is sutured into place by the veterinarian. So I can move on to my friend here, has had a E-tube placed. We place these basically so an animal can go home and continue to get the nutritional support that they need, and they don't have to stay in hospital to receive that. There's multiple reasons why an animal would not be able to get the needed nutrition, but it could be a structural issue, they have a mass in their mouth, but often it's just because they don't really want to eat. So they have an underlying disease process that's made them lose their appetite. Our appetite stimulants are not effective enough, and we want to make sure that they're getting the nutrition that they need so they can continue to heal. So this patient here has had a esophagostomy tube placed and sutured into place. At home, the most important thing that you're going to want to keep an eye on is this insertion site. So there are a few different things. This is the kitty collar that we keep on there to keep the area protected, and it's nice and padded. It also comes with these little pads that go in between the tube and the e-collar, because for the first few days up to a week there's going to be some normal seepage, sort of like a pinkish liquid that is part of the normal healing process. Your job is to make sure that there's no signs of infection. So that is going to be an increase in redness, swelling, discharge, pus, a foul smell. These are all signs of infection, and you'll want to contact your veterinarian if you see anything like that. This is to help absorb some of that normal seepage. It goes over here like this, and then the e-collar goes over it. That's just to help absorb and keep this clean in between washes. So each set comes with a few of these. They are very similar to the normal cosmetic pads that you can get at any store for like makeup removal, and then you can just cut a little slit right there and then it will slide right back on. So you don't need special pads. It's important to check the insertion site at least twice a day. I recommend just making it part of your routine with breakfast, with dinner. We don't want it to be a stressful situation where you're chasing your pet around the house and trying to wrestle them and look at it. Just take advantage of when they're sleepy or when you're just having a nice little cuddle. You can just take the collar off, take a quick peek, make sure everything looks good. If there is any need to clean it, you just use a warm washcloth that has been, wrung out really well, and just dab it. No soap, no astringents, anything like that. Just a warm compress to loosen up any dried discharge that might be on there. So when properly cared for and kept clean and without infection, this site should be pretty healed up within a week or so. I tend to recommend continuing to use the pads even once the discharge has ceased, just because it is always clean, so you can replace it on an as needed basis, but at least once a day. That way you don't have to wash the actual collar as often, but you should wash this once a week, once every other week, depending on how dirty it gets. While that's being washed, this will be exposed. So some owners will buy a second one, or I've seen some creative solutions such as a clean sock that has been cut and then wrapped around with a little hole. You can use just anything to protect the site. The important thing is that it's not put on too tightly, and that your pet is able to breathe and move comfortably. The same is true for the collar itself. So let's go ahead and put it back on now that we've checked it's nice and clean. It just slides through a little hole here. It goes right on like that, and then a little Velcro like so. So it's not so loose that if he was to scratch at it, it would rotate about. But I like to put, a couple fingers under there to make sure that it is not too tight. If it is too tight, they may tell you, or there may be some facial swelling if it is on there too tightly for too long. It also has a little Velcro strip here where you can secure that so it is not just flopping about.